Hey, this is Andre. Nice to see you again. It's been a while since my last video. I hope that you're all doing good, and I am making a video today about what to expect from your first session of somatic trauma therapy. So this is something that I am really, really interested in. I think so many people could really benefit from it. I think it's always a very strange, quite a tricky question to answer when people ask me, so what happens in a somatic trauma therapy session? What's actually going on? And the idea with these sessions is that we really focus on feelings rather than thoughts. It's not that thoughts are not important. It's simply that we spend quite a lot of time trying to experience sensations in the body and experience feelings in the body, something that I suppose we have all become all too um, well acquainted with avoiding. So I think it's very easy for people to escape their bodies with distractions, activities, thinking. Really, as a society, we haven't um, learned so much the language of sitting with feelings or um, experiencing what's happening in the body, and yeah, understandably so, because there's so many things out there who actively encourage us to be distracted and to not be in the present in the body. So it's a very quick and easy and succinct, I suppose, way of explaining what happens in somatic trauma therapy in the first session or otherwise, is to really facilitate the habit or the language of experiencing sensations or emotions in the body. And the idea is that once we do that, spontaneous insights can happen. So similarly, like, not similarly, but I suppose in psychotherapy or talking therapies, insights might have happened via talking. In somatic trauma therapy, we believe that insights can happen and do happen via tuning into what's happening in your body. As for the first question of what actually happens in the first session, for me, at least when I'm working, I really what I really want people to experience in the first session is a feeling of safety and a feeling of what pleasant and goodness feels like in their bodies. So there's a variety of ways in which we could do that, but to me, that is goal number one, is for people to experience what does goodness feel like, especially for people who, for all of us, but especially for people who have for a long time not experienced goodness at all in their bodies, either be it for chronic pain or for anxiety or depression or whatever it might be. So that is a big, big thing in the first session, is to foster the feeling of safety and goodness before we do anything else, really. But I hope that clarifies for people who have been asking me what happens a little bit. I appreciate that it might still sound a little bit vague, but it is facilitated way of being a bit more embodied and staying with your own feelings and discovering and remaining curious about what that might mean, or what might unfold once you do that. So that is it. I hope that you found this helpful, and thank you for watching. Thank you.